Back to school means more time buried in books and staring at screens, a recipe for eye strain. Let's welcome back Dr. Betsy Fraser, Doctor of Optometry at Compass Vision Care. Great to have you back. Great to see you.
Thanks for having me.
Yeah, so kids are complaining now, I can't see the board or the print is too small, but it's important to get your eyes checked before the school year even starts, right?
Right, yeah. Absolutely.
Why is that?
Well, 80% of learning is through vision. And so, we want to make sure those kiddos have their eyes ready to go before the new school year starts.
Right, and it's good that they've had kind of that summertime to sort of relax, rest their eyes. And so they're sort of at like a neutral place?
Yeah. I mean, I think depending on what their summer activities are, hopefully they're out, outside playing. We all know that the more up close work that kids are doing these days, the more nearsighted kids are becoming, which means they're having a harder time seeing far away. So especially if they've had growth spurts and things like that, the start of the school year is a really good benchmark to just check that off the list.
Right. And so what would be some of the first signs that parents should look out for that their child, if they don't verbalize the fact that they can't see very well, what can they take notice of to maybe intercept?
Squinting is one. If you start noticing them kind of, squinting at the TV, headaches, maybe complaining of headaches, things like that, or just simple avoidance of near work. Maybe they don't like to read for whatever reason. Right. So, and you make a good point. I mean, a lot of kids, what they see is their normal. So they don't know to articulate that there's an issue there.
Sure.
So that's really the reason for promoting those back to school early eye exams for kids.
That's what I've always wondered about, especially with babies who get fitted with glasses. How do you know that they can't see? And sometimes they're Coke bottle glasses in some cases. So how do you make that detection just as a parent?
Well, sometimes parents will come in complaining that maybe the baby's not making eye contact. Maybe they feel like they're looking kind of right through them, not holding that contact. And that's really why we advocate for early eye exams as early as 6 months old, to get them in so we can make those observations, because again, all of that is objective at that point in time. It's something that we're going to be able to detect that, the parent might not know that there's anything off.
Right. Yeah. And so when you take your child to get an eye exam, what does that all entail? What kind of equipment are you using these days to detect nearsightedness, farsightedness?
It really depends on where you go. We like to do digital retinal exams to make sure that the back of the eye is healthy too.
Sure.
So it's really as quick as taking a photograph of the back part of the eye. We're using other instruments that give us a sense of, are they farsighted, are they nearsighted? We try to make it fun and engaging. A lot of it falls on the optometrist being able to determine, what can that child really see.
Right.
Some kids want glasses, may not necessarily need them.
They're so stylish nowadays. Who doesn't? I've always wanted glasses.
Yeah.
Now I've got my wish.
Yep.
Yeah. Now I've got my wish, now that I'm a little bit older. And then AI, we talk a lot about artificial intelligence and how that is helping in so many different fields. Is it making an impact on optometry?
It is. And I think that there's so much more to come, but what we're really seeing now is perhaps early detection of different eye diseases, better surgical outcomes, for different corneal problems, perhaps tracking and monitoring diabetic retinopathy, better treating dry eye disease. So using these algorithms that, really allow us to compare patients in their same demographics and get so much more information.
Sure. And also diet. So let's talk a little bit about diet, nutrition, very important for just a child's development period, but there are certain things that you should make sure to incorporate in a child's diet because their eyes do depend on it.
Absolutely. So not that they love it, but green leafy vegetables. So your spinach, your kale, your collard greens, I mean, those are actually better than carrots. Carrots are, carrots are great, but the green leafies are better. So, it's hard to get those in for the kids, but
And do you recommend laser surgery on young people? No.
No.
Do you
So
recommend it at all?
I do, if you're a good candidate for it, but we want to make sure that the visual system has stopped changing.
Yeah.
And oftentimes, especially now with people obtaining advanced degrees and people in school a lot longer, our visual system continues to change.
Yeah.
So you want to make sure it's stable. So that's a really big question for a lot of my sports kiddos. They want to get out of their contact lenses, and so it's really a matter of educating them on why we need to wait.
Right, of course.
Yeah.
And then finally, because we're staring at screens all day, all of us do it, the protective eyewear, even if you don't need it for magnification, the protective eyewear against blue light.
Blue light.
Is that also recommended?
Yeah, I recommend it every day to patients. We have a conversation about it. There's still a lot that we don't know about blue light.
Sure.
But we do know that increased exposure to blue light does decrease melatonin. So especially if your kids have a hard time falling asleep, staying asleep, that's a good indication that blue light filters will be beneficial.
And then I think the real challenge is making sure that they remember to wear the protection. All
That's
right.
right.
Thank you so much, Dr. Fraser. Good to see you.
Thank you.
We're back after this.